It is Tuesday, January 6th. This is Jeff Davenport Live, brought to you by SSVEC, Sulphur Springs Valley Electric Cooperative, serving our community. We find ourselves in Willcox, Arizona, for the grand opening of the Chiricahua Willcox Clinic. We are here to present, or actually watch a presentation, and then go to a ribbon cutting that's going to be happening today. It is a big time who's who of who is anyone right here in our area today. Take a look around we got the mobile medical unit on site. They've got some food and finger foods and yummies for folks here, as well as everybody who is getting ready to rock and roll today for this amazing ribbon cutting. Presentation coming first, followed by the ribbon cutting. Thank you so much for joining us. Thank you so much for sharing this video here. So glad you're here. Oh, Mayor Mike Law is hanging out with you. How are you, sir? It's good. Happy New Year, sir.
I'm good. Happy New Year.
I talk about what, as a Willcox resident, a long time, supporter of all things in Willcox. What does it mean to have something like this, an actual on-site location for Chiricahua Community Health Center?
It's awesome. We've been waiting for it a long time, and I don't know, the politics got involved, I guess, or something. I don't know, but that's my daughter. Where'd she go? Anyway.
Yeah, they're all here. Yeah,
they're all here. But anyway, we usually go in that building.
Yeah, exactly. In the mobile unit, but now you got a hard on-site unit, and we do. Yeah, we're so proud of you and so how happy for the town of Willcox.
How you been?
And all. Oh, good. I mean, just
see you all over.
Oh, so you're the one. I wondered who that was. It's good to see you. But thank you so much. Congratulations on this, and moving forward in keeping Willcox very strong. This is the exciting thing that we get to see and be a part of here, and knowing what goes on here. Absolutely. No, we're so glad to be here. We got representatives from Cochise County. Of course, we got State Senator David Gowan as well.
Hello there. How are you?
Happy New Year. Good to see you.
How are you?
And
all right, what crazy stuff's going on, Jeff?
Well, I get to talk to you, so that's kind of crazy. I see you everywhere, but I never get the chance to talk to you. What does it mean to have something like this going on here in Willcox today?
Oh, this is great. You're going to have some primary care for adults and children, right? So you got pediatrics going on in here as well. Out in rural Arizona, we need these structures. We need to get our doctors and such out this way. You get out in the real rural areas, and it's hard to get them. So for our surrounding communities that surround Willcox area, from the north, south, east, and west, this is going to be great. Not just a hospital, right? You'll have a place to go to get healthy.
Yeah.
That's going to be great. It's wonderful.
Well, and Chiricahua was all about, it was built on that rural mindset, the rural medical care. And to see it actually having firm locations in and around all across Cochise County, there's something really exciting about it.
And that's always the great thing, right? When you can get a program like this that goes all over. But the great thing here in Willcox is your closest is going to be Benson and Safford.
Yep.
Right?
Yep.
So this is great for Tombstone's got a little clinic too, but you got to be able to maneuver around. So, but this is going to be great for the surrounding communities up in the north.
Without a doubt. And everybody's coming around here. We'll let John lock in as
all right,
we get ready
everybody.
for.
We're going to be getting started. If everybody wants to come on over.
Dr. Jonathan Milk will be on the microphone, walking us through our presentation today.
Mr. Davenport, how are you doing? Nice to see you.
Happy New Year. Good to see you.
Please fill in the seats.
Yeah, there's some more seats left here.
And then come around to the back. Seats are open.
Still some open seats here. So I think I'm going to take this out. I think everybody, we need to talk right into the microphone.
Yes.
Otherwise, I don't know if they're going to be able to hear as well. Oh, sorry. Got it. All right. Good morning, everybody. Happy New Year, everyone. Feliz año. My name is Jonathan Milk. I am CEO of Chiricahua Community Health Centers, and welcome to the grand opening ribbon cutting ceremony for this humble yet beautiful step forward for the healthcare of Willcox here, which is right behind me. And thank you, everyone. So I want to recognize some of the attendees that we have in the audience that won't be speaking today. want to, or that maybe couldn't make it, but played an important role in this. Willcox City Council members, you have Tim Bowlby, Becky Akes, Carl Hested, Mike Laws, Paul Sheets, and Tyler Bowen, as well as city staff who do much of the carry out the will of the city. And there was a lot of bureaucracy in this project, and they were very helpful. Can people hear me okay? Yeah, okay. So, and just hold your applause. I'm going to go through a bunch of people. We'll do one big round of applause at the end. We also have, is Selena Valenzuela? Is she here? Selena? Selena may be joining us from Governor Hobbs' office. Robert Guerrero, is Robert here?
He has a flu.
Okay, Robert was going to come from Senator Kelly's office, but wasn't feeling well today. I do believe I saw Zach Royce. Zach, there he is, right here. Zach Royce is from Senator Gallego's office. Thank you for coming. Fiona DeYoung, right there she is. Okay, thank you. From Congressman Siscomani's office. Mike Smith with Truly Nolan. I know Mike's here. There he is. He's from Sky Islands Regional Partnership, representing Sky Islands Regional Partnership. Julia Strange, right here in front. Julia Strange is Vice President, Community Benefit from Tucson Medical Center. And Mr. Gary Karshner, my fellow CEO, who is CEO of Benson Hospital and our Willcox Northern Cochise Community Hospital. Thank you, everybody, for coming today. Thank you for coming and making this even more special than what it already is. I also want to say I saw we have a board member here, Larry Sanders, if you want to raise your hand. A board member of Chiricahua Community Health Center. Thank you, Larry, for making the trek over from Benson. And I also want to recognize Jessica King, Chief Operations Officer, longtime COO. There she is. Alejandro Cuellar, who is our Director of Health Center Operations. Where are you, Alejandro? There he is. Margarita Guevara, Health Center Operations Manager. There she is. I don't think Eric Moreno is here today. Eric Moreno is Senior Supervisor of Facilities and IT. And then many, many other members of Chiricahua's operations team. Our operation team consistently, when we try to get them in front of the microphone, they say no. We work in the background. But none of this would be here if it wasn't for Chiricahua's operations team, period. So thank you to our ops team. I also want to say, I don't think Rob Fisher from Vast Real Estate Solutions could make it, but he helped us a lot with project management and logistical support. And most importantly, I'm going to recognize the Chiricahua staff who are actually going to be working in this building, who have been working in Willcox, who live in Willcox and work in Willcox and are part of the community. And I know we have Dr. Smith here somewhere. There, oh, there she is, right in front of me. Dr. Smith. Carlos Martinez. Where are you, Carlos? Right here. Okay. Got to look here. Okay, here we are. We got it. Okay. Dulce Castillo. Dulce. Milka Olivares. And Nancy Tovar. Thank you. Did I miss any local staff? Is that the team? Yeah. So this is our dream team here in Willcox, who, again, they have not only are going to be working in here, but they have been working there. And they've been working there for years and years and years, which turns out was not adequate. I just want to say a few more comments. 1996, Chiricahua's founders opened our very first health center in the Alfreda Community Health Center, which is a humble tin building. And they opened it with a bold vision. And to many people, it was an unlikely vision that one day Chiricahua would serve the primary care needs to any person in Cochise County. And not only that, but regardless ability to pay. Over time, one by one, additional clinics opened first in Douglas, then in Bisbee, then Sierra Vista, then Benson. In the Willcox region, for the past 25 years, Chiricahua has been providing primary care services via a smaller and then a larger mobile medical clinic. And then we added a mobile dental clinic in 2006. And I saw that we have Terry Kibler here. Terry has worked there. She is also a member of the Willcox Chamber of Commerce, but another Willcox native here who worked on that dental clinic. And we added that in 2006. And so for the last 20 years, 25 years, this is how we've been providing primary care in the Willcox region in northern Cochise County, has been via these mobile medical clinics, which are really unique and really, they can really accomplish a lot, but they can only accomplish so much. You can only see so many patients. And there's a lot of inconveniences, especially for elderly patients or disabled patients, et cetera. And so that being said, in 2024 alone, from this clinic off to my right, Dr. Smith and team saw 1,693 individual patients, over 3,000 encounters off of those four wheels, and it's just not big enough. And so they were very anxious to get something new. We were too. And I have to say, despite the efforts of Chiricahua and our other partners who provide primary care and health services in Willcox, it's not enough to meet the need and the demand of the people that live here. You may recall that Chiricahua actually has shelf-ready plans for a 20,000 square foot building. I can see it in my mind's eye. It's behind all of you where all those bushes are currently now. It's a state-of-the-art primary care facility modeled much off of Benson, for instance, and it's going to include medical, dental, behavioral health, pharmacy, and other enabling services. Unfortunately, we all know about inflation. You may know about skyrocketing costs for new construction, and that has put these plans on hold. However, with the help of grantors, and again, true grit and determination shown by Chiricahua staff and board, we are opening this new and more spacious facility as our next first big step towards the facility that will eventually exist behind you, what we are calling the primary care complex. With this building behind me now, we're going to be able to expand our hours of operation to Monday to Friday, as well as add pediatric services. We also, as you will see when you tour the lobby of the clinic, we've added a pharmacy kiosk, and off to my right, in the near future, there's going to be a freestanding pharmacy here that we already have funded. Chiricahua's expanded services will not only serve Willcox residents, regardless of ability to pay, but also those from nearby towns such as Cochise, Bowie, San Simon, Pierce Sunsites, as well as from remote areas including Bonita, Winchester Heights, Dragoon, Sunizona, Portal, Kansas Settlement, and everywhere in between. Today's ribbon cutting is a living example of the power of partnership. First, we always need to recognize the Federal Health Resource and Service Administration, otherwise known as HRSA, who administers the health center program, like that Chiricahua is a part of, and it contributed financially to the site preparation that we're all standing on today. The actual clinic behind us was supported significantly by the Delhi Webb Foundation, who went out of their way to help us build this here in Cochise County, all the way from the metropolitan area. The equipment that's going to be used in this facility later today was supported by Arizona Community Foundation and other private philanthropic organizations. And lastly, construction and permitting for this facility was delayed and delayed and delayed again, and then got delayed again by federal and state bureaucracy, of which we have to thank the City of Willcox, the Office of Senator Mark Kelly, and the Cochise County Department of Health and Human Services, who are all critical to getting these licenses, permits, and approvals facilitated so that we could open this clinic up today. On a personal note, and then we'll start with our speakers, I just want to say after 20 years of working with Chiricahua here in Cochise County, I personally can't imagine a better way to kick off 2026 than today's event to finally get this clinic open, that again, to take this next first small yet big step in improving access to care, primary care for the northern part of the county. Thank you. So with that, I'm going to introduce our guest speakers. One moment, please. Sorry, too many sheets of paper. Board members. Must be in here. It's not down there. Here it is. Okay. All right. So, okay. First speaker today is our mayor of Willcox, Greg Hancock.
Good morning, everybody. It's so nice to see everybody here. There's a lot of people here to help celebrate this. I just wanted to first off congratulate all the Chiricahua staff. I know it was a long road. I wanted to congratulate all the administration, that all the work they put into this, and also down to the physicians and the nurses. I know they put a lot of work into this. And I was kind of looking at the goals of the foundation of the Chiricahuas, and one of them that I really liked was to give health care to all. And I think they've really achieved that goal. The bus, I've heard it's gone to just about every corner of Cochise County to bring health care to all of Cochise County. So that's, so I think they're on par for their goal. And so it's nice to have an actual brick and mortar, I guess, kind of here, and a kind of a permanent spot. We'll be able to give more health care. That's something our residents want, and that we need to give to our residents. And so, it's kind of exciting to know that there's a future to all this, that they're going to be able to bring more services to the community. We love our hospital, and we love Chiricahuas here. So once again, I just want to congratulate them on all their hard work. And I know that, like you mentioned, he ran into some hurdles, and it seems like they've gotten over them. And we hope there's a bright future here, and we can help supporting Chiricahuas. Thank you, guys. I guess now or you want to cut it back?
Thank you. Thank you, Mayor Hancock. Next speaker is State Senator David Gowan.
Thanks, sir. Oh, what a lovely day, huh? I get to come out into the sun now. A little chilly over there on that side. What an awesome thing, huh? Things that we have to worry about out in rural Arizona that they don't think about up in the great state of Maricopa or Pima. And it's things like this where we get primary care and primary care for our citizens. And the great thing about this is going to be, as you heard earlier, it's about up north, east, west, and south of us, right? I mean, this whole northern community of Cochise County will have a place to go for primary care finally. What a great thing to have. No more having to go to Safford, go to Benson out there. Sierra Vista, I guess you will if you need for your eyes. I just went to Cochise Eye and Laser, and I just found out that's the only place in the county that does that. Checks for glaucoma, treats your eyes. Those are things we need to get out in the rural regions, out here, Douglas, all the areas around, even Benson, I guess you could, even though they're close to Tucson, them. They're like a little Tucson stepchild. I keep pointing at him because he's out of Benson, so I'm just teasing him. My seatmate, he'll be coming up in a second too. It's going to be wonderful once you get this put up too. I mean, that'll be a hub right here. It'll be a hub for the north here, not just northern, but also Graham County. Guarantee you'll start pulling from there just as well. And maybe even some New Mexicans, right? Come over from right over there on the border. It's not too far away. Very important rural health care. Big issues we've been fighting, definitely with the hospital stuff, is making sure that we get the dollars in the rural regions to grow our health care. And a lot of money gets stuck up in the city. And so, with your three, Representative Griffin is not here today. She's up there taking care of other business, like our water stuff. Imagine that. So, three of us, we take these issues seriously, and we take them up to the state, and we like to beat up those bureaucrats that you keep talking about, because bureaucracy likes to step in the way sometimes. Who's a bureaucrat here? Raise your hand. Look, they're scared. They're scared to raise their hand. Oh, yeah, I know. So this is wonderful. I'm glad you guys were able to put this up and get this going. I look forward to the day when we get expanded. No more jumping into that, but actually now you got a place in for not just adults, for the children now, right? So this is wonderful. I'm really grateful, and I can't wait to continue to help for any future plans we got. We were just talking about USDA, right, and trying to get some dollars in to see if we can help there. I know we got our Fed guys here, but I know the director too, so I don't think you guys have the corner of that. So with that, appreciate you guys. Anything you need, you know, the door is always open at the Capitol for you. You're my constituency, and you're who I take care of. You're like my family. So if you need anything, make a call. All right, appreciate you.
Thank you, Senator Gowan. Next is actually a surprise guest today. We're glad that you can make it, Representative Lupe Diaz.
Thank you for the introduction, Senator Gowan. Anyway, you know, it really is good to have as many of the communities that we visit as state representatives. It's great to be able to have something local. And you know, the whole goal of, you know, the hospitals and the clinics, and, you know, even with the health department, Cochise Health Department, is to be able to provide and keep our citizens healthy. I think that's really, really important, to be able to help provide those services to the citizens around us. And it's really important for us to be able to do that. I serve on the appropriations committee there at the House. And that's one of the things that we really look at, is the money's coming through so that we can support our rural communities. And we fight hard for those kind of monies. You know, there's always talk about sweeping monies to be able to afford something else, but we're up there really supporting the rural communities. And you really need to know that like Senator Gowan said, you know, your family. I live in Benson. I think that's not a surprise to you now. And it's great to be able to know the people that you're working with. In fact, I've heard Dr. Smith's name mentioned several times, because you've taken care of my wife, and also Dulce. Who can forget a name like that, you know? and I know that you've taken care of some of our family members there too. Being healthy is really, really important to families, and I think that this is great that there's a fusion going on between the hospital, the clinic, and also the county. It's just wonderful to be able to see that. And for the hospital, we've been fighting for the critical access monies. Last year, we fought hard for it. I mean, we were keeping that line item, and we were watching that real careful, because they were wanting to take that away. And we were hammering them not to take that away, and we were able to get it, and we will continue to do that. And it is a beautiful day out today, and it's just wonderful to be able to see, you know, faces that care, and you know, that are very supportive of the community. And you're one critical piece of the community here. So God bless you all. I have my holiday tie on, you know, and that's because today somebody says, wait, holidays are over. Today is the Epiphany of Christ Day. So that's one of the reasons I have it on. It'll come off after that. So God bless you all. Have a wonderful day.
Thank you, Representative. Yes. Next, we have Barbara Lang from Cochise County Director, who's Cochise County Director of Health and Social Services.
Good morning. Gosh, I couldn't have followed better speakers. We're talking about the power of rural. We're talking about healthcare. We're talking about keeping infrastructure and monies here in Cochise County. It is absolutely a privilege to be here to celebrate the opening of the outpatient clinic for Chiricahua. They've been an amazing partner. There's a lot more to come. I know my colleagues here talked about the continuum of care. Outpatient clinics are vital foundations in communities. And this isn't just a building, it's an opportunity for accessibility, for community wellness. And so to have this here in this community and partnering with the public health department is amazing. So I just want to thank everybody for being here. Thank you to all the workers, the providers, the healthcare people that came to support, the community members. We're excited for this to open, and I think it's just the beginning of a wonderful future. So thank you so much.
Thank you, Barbara. Monica Preston, Willcox Chamber of Commerce President. Yes. There you go.
Thank you. Well, it is a beautiful day. It definitely warmed up nice. Don't need sweaters now. But anyway, it is my absolute pleasure to welcome you all here today and to enjoy this exciting occasion, the grand opening of the Chiricahua Community Health Center right here in our wonderful town. The new healthcare center represents more than just a building. It stands as a symbol of progress, hope, and commitment to our community's well-being. We all know how important access to quality care is, not only for our families, but also for our local businesses. Healthy residents make for a vibrant, thriving economy, and now, with Chiricahua Community Health Center, our town can look forward to a brighter, healthier future. The impact of this center will be felt throughout Willcox. Local businesses will benefit from the healthier workforce, and job opportunities will be created right here in our backyard. For medical professionals to support staff, this center is bringing new employment and economic growth to our area. This means more families can stay, work, and build their lives in Willcox. Most importantly, the Chiricahua Community Health Center is a testament to our shared values: caring for each other, investing in our neighbors, and building a resilient community. I want to thank you guys. Thanks for putting this in, providing this opportunity for all of us. To the dedicated team of our Chiricahua, our city leaders, and all the community members who supported this vision. Let's celebrate this milestone together. We look forward to all of the good things to come. Thank you.
Thank you, Monica. Before I introduce our final speaker, and then we're going to have tours, I just want to say thank you to each of you who came. You really elevated, dignified, brought importance to the event. Thank you for making the effort, as well as those in the audience today. Thank you so much for showing up and being part of this. Our last speaker is Dr. Jennifer Smith, who is an internist who's been working with Chiricahua for years. And we give you the final word.
Thank you so much. Thank you, all of you, for coming and making it through these speeches so far. I'll make mine quick. We've talked a lot about how our constituents and us together, we play a role together in delivering healthcare to this community that has so many needs. And so I just want to take one more moment to recognize the village that I work with, my direct team every day, our PSR, Carlos Martinez, who went to middle school and high school here in Willcox. He's an integral part of our clinic. He's one of the first faces you see when you come in. Our MA supervisor, Dulce Castillo, who started in kindergarten in Willcox, middle school and high school, and 2 MAs, medical assistants, Milka Olivares, who started with Chiricahua straight out of high school. Been living in Willcox since she was in middle school, and I'm proud to have worked with her since she started with Chiricahua. And Nancy Tovar, who's joined us in about the last year, but just came over from the Benson Clinic, born and raised in Willcox. And I am with Willcox with Chiricahua since 2018. I started in the Benson Clinic, and then I started full-time here in Willcox with the mobile unit in 2020. I'm an internal medicine physician, and it's been wonderful. It's been a lot of growth, and I do want to talk a little bit about that, which is I feel like primary care, healthcare is delivered in this space of need. You go from the need you come in with to the resolution of the need, and that space in between, having your need and having your needs met, there's often a lot of frustration experienced. I know it as a patient myself. I know it as a provider. And it's not easy, especially if you've been looking around for healthcare and it's been hard to attain. And you come in and you have a concern, you have a symptom, you have paperwork, you have concerns you might lose your job, whatever it could be, if you don't have your needs met. And so you kind of can start in a little bit of a frustrated place. But I just want to kind of point out that that space between the unmet need and the resolution of the needs also represents a place of growth. There's a lot of learning in that time. That's the brighter side of the frustration, is the learning that we all get. We learn as providers, as a healthcare team. Patients learn about health and wellness and having their needs met. And the community learns about what patients need, what we all need, and the system learns about what is needed as well. And we're all informed by that. We develop more trust, we grow. And so in that little frustrated space comes a lot of growth and trust and learning. And it's the bright side of what we do. And that's where we'll meet you here. See you. And thank you.
Thank you, Dr. Smith. We are proud and lucky to have you. So Dennis, we're now going to do the ribbon cutting. So our ribbon cutters are going to be the staff, and Dr. Smith is going to cut the ribbon, and our staff is going to be right here, because again, they're going to pull this whole thing off.
I would welcome everyone to come. We're going to shift a little bit.
Thank you for coming.
It is a beautiful Tuesday here in Willcox, Arizona, as we're here for the ribbon cutting here at the brand new Chiricahua location here in Willcox, Arizona. The Chiricahua Willcox Clinic, open for business.
Everyone is going to come up. Staff in front. And then I would like to have representatives from TMC, please come back here. City Council. And we're going to have, we have layers, so I'd like to have some, maybe the City Council members here up on the stairs. Your support has been so vital to this. Yeah, I would like to fill, yeah.
As we get ready for this ribbon cutting
Anyone who's not taking a picture?
here at the Chiricahua Willcox Clinic.
We want everybody. We would love to have everybody up here.
Those scissors are probably getting very heavy,
You
but
built the joint? We'd love to have
leave some
everybody.
love in the live chat. If you are in Willcox, we need you to share this video around. Let everybody know what's going on this episode of Jeff Davenport Live, brought to you by SSVEC, Chiricahua Community Health Center's Willcox Clinic. Health for all here at Chiricahua, now in Willcox.
No, we're not. Hold on, hold. All the way down. Come on. So Wendy, let's get you right over.
Got to make sure that the photos look good. All the
Right,
video.
everybody,
Here we
ready?
go.
3, 2, 1. Chiricahua!
It is officially open. The Chiricahua Willcox Clinic, Chiricahua Community Health Center is providing health for all. Again, it's
Thank
an
you.
awesome,
Thank you very much,
well-attended.
everyone. Please enjoy some pastries, some coffee, some water, and we're going to be doing some brief tours of the facility at this time. Thank you so much.
That was Dennis Walto, one of the heads of Chiricahua Community Health Center, announcing that, yep, the tours will begin as people will head inside to see what's going on and see how well it is put together. This is what healthcare is all about. Rural healthcare is what Chiricahua Community Health Center prides themselves on and has done for so long, and we're so proud of everything that they've done, and we're grateful that you have watched this video today. I wonder if we can get another word with Dr. Melk. Or Dr. Jonathan go? Excuse me.
I still forget about false prescription when I'm coming back, but yeah, I can have
We'll have a word here with Dr. Milk in just a second to talk to you. Is that okay to talk to you, sir?
Yes, absolutely.
Dr. Jonathan, good to see you.
Yes.
And first of all, congratulations on this. Just another
you.
outstanding job by Chiricahua Community Health Center. I was just talking about how Chiricahua has always focused on rural healthcare and being able to have the mobile medical unit here for so many years serving the Willcox area. What does it mean to step up the level of care by having this brick and mortar?
Well, we are proud of the services we were able to provide off of the mobile medical clinic for 25 years. However, it wasn't enough. And so even though this is a small next step, it's not where we are going. It's a big next step that was made possible by various donors. And yes, it's gonna really open up services Monday to Friday. We're going to add pediatrics. In the future, we could potentially add behavioral health. It's going to be a big step forward.
Well, we're excited to be here for it. Congratulations on all the success and continued health care for all in Willcox and all across Cochise County, all because of Dr. Melk, his entire team, the staff, all of the people who make this work all across Cochise County. It's absolutely awesome to see.
Thank you so much. Thank you for being here.
No, thank you, Dr. Melk.
Thank you, sir.
Oh, yeah, we can go peek at. Are we going to get a quick tour? Oh, gosh. Oh, we're going to get a sneak peek here. Look at us. I'll let John go ahead of me. And let's take a peek at actually what it looks like inside. You got Dr. Darlene heading in. And then we'll let Senator Gowan go in, and we'll follow in. Here we go. So as they mentioned, they said this was going to be the pharmacy. So prescription pickup, right?
Yes, they prescription pickup. The patient comes and they get a code through their cell phone, and then they input that code, and then one of the little cabinet things opens. There's refrigerated medication, and then there's like the not refrigerated. So it's pretty nice. Yeah.
So this is a wonderful tool. So what we do a lot of in primary care is chronic disease prevention and management. And so this obviously doesn't work if I have an infection I need to treat that day. But this is wonderful for anybody on blood pressure medication, insulin, any of those chronic medications, so that we can ensure they have access and they don't have to have an appointment. We just have to be open. But it's a wonderful way to bring medication. They order. Yeah, so the provider orders it, and then if they have refills, then our pharmacy team comes and fills it. Right, basically weekly. So it's
fantastic. Really cool. This is just literally step one. Here, walk inside and see what this looks like. As a patient would come in here to the Chiricahua Willcox Clinic, several exam rooms that I'm seeing around here. This is great.
Yes, this is where it all begins. We start with the patient weight and height, and then we just come in.
I'm still carrying some holiday weight from 3 years ago, Senator Gowan, I think.
And then these are our exam rooms. Most of them do look about the same. Okay, we have just some of the needs that they carry, and this is the basic exam room. Okay.
Wow. And how many exam rooms are here?
We have 4.
Okay.
4 exam rooms in total. Yes. Yeah, we have. This is our nurses station. Yep, our nurses station. This is where we sit most of the time. Doctor's office is like way over there, but yeah, you guys can look around.
Wow, what a great thing for the Willcox community here. The Chiricahua Willcox Clinic now open. The ribbon has been cut.
The ribbon finally has been cut. Yes.
You've been waiting so long for this, huh?
Yes,
I mean,
we have. We moved here to the area about a year ago exactly. Wow. And we waited all that time. But
well, we were here for the groundbreaking a year ago when the ground was broken for this clinic. And so it's exciting to see it come all the way through.
All the way through, yes.
And know that healthcare is available for Willcox here in northern Cochise County through Chiricahua Community Health Center. We'll run around here real quick and just take one more look at the brand new Chiricahua Willcox Clinic. It's Jeff Davenport Live, brought to you by SSVEC.
Yeah, this is our lab.
Oh, wow.
Okay, this is our lab area. This is where we're going to run our labs and just store them. And yep, this is our beautiful lab area.
And like was said during the presentation is that while you have the pharmacy there in the front, the goal is to eventually build an actual building next to this one for pharmacy.
Behind, next to that one. Yep.
Yeah.
Yep. For the pharmacy only. Yep.
This is great. It has that new clinic smell. It smells great. This is fantastic.
And then this is our, I want to say kind of special room because it has like a wheelchair weight. So in case we're not able to get a patient on the regular scale, we can come and get the scale here. We have pediatric equipment as well. So this is a little bigger room. This is a more, it's a nice room just to have
And
the
again,
handicap.
making sure it's wheelchair accessible.
Yep,
I mean, all the
wheelchair
things.
accessible.
So again, if you are living in the greater Willcox area, this is where you need to be. This is the Chiricahua Willcox Clinic. Senator Lupe, good to see you.
Yeah, good to see you.
I was going to say Pastor Lupe, but I mean,
that's right.
And that still works too.
Representative D. Yeah,
No, Representative. Thank you so much.
Yeah.
And thinking about something like this in Willcox, all the work from the office that you serve in and all of your other colleagues to make something like this happen. This doesn't happen just by accident. It is actually planned out, and it works together in cooperation with politicians and people to be able to move things forward. Is that correct?
That is correct. And then from the federal level all the way down to the local level, I think it's really important to acknowledge that there's a lot of collaboration and work to be able to be done there, and then to be able to have something local available for the people here. It's really great. And then I just met the pediatrician, and that's my favorite person because they deal with the children, and that's our next generation coming up. And we want to see people healthy. We want to be able to provide things that will allow them to stay healthy and moving forward and having a strong, thriving community. So,
you talk about the children. It's interesting when they talked about the people who work here, they were born in Willcox. They went to Willcox High School. How many people are local that are a part of this? And that's remarkable as well.
That is really remarkable. To be able to have people that and people that understand you, I think that's really important. And it's great to be able to bring them up from the bottom up. And so to be able to have some folks that people know, I think that'll be really also helpful for people to come in and be able to trust the services and the products that are provided. Yeah,
without a doubt. Representative Lupe Diaz, good to see you. It's been a minute. Happy New Year.
Absolutely.
Good to see you. And I think we can pretty much wrap it up here. Dr. Darlene, we'll finish with you. We'll let you get the last. We'll let the professional get the last word here. Obviously, you and Dr. Jonathan have been a part of this thing. Did you imagine, when you first came here, that Chiricahua would become a literal county-wide operation serving, is it 1 out of every 3 Cochise County residents? Could you see that? Was that ever a goal or a vision, or was it just something that you knew that you had to fulfill?
Gosh, I don't know if I would say it was a goal. I think our goal has always and continues to be to serve anybody who wants to come to us. And we grow by need and demand. And so just knowing that there was need in Willcox, we started 25 years ago on the mobile, and then more and more just needed more space, right? And so, we've tried, and that's kind of been what we've followed, is to follow the demand and the need and grow as necessary. But our guiding star is that anyone who needs a medical home can find it with us. And that's what I love about Chiricahua and any federally qualified health center, is that we don't have to turn you away if you don't have insurance or can't afford it. And so, that's the goal, is be here for anybody who wants to come see us.
I love that. And I was just talking, one more question. I was talking to Representative Diaz about the interesting part about rural healthcare is that here in Willcox, the number of people who work for this Chiricahua in Willcox, they went to Willcox Elementary School. They were born here. They went to Willcox High School. How important is that to have familiar faces behind the nurse's station as you come into the Chiricahua Willcox Clinic?
I would say that's the beauty of community health centers. And the community health center movement started that way, employing locally, directed by a board of directors that live locally. I think that is so powerful because why? They are motivated just as much as we are as leadership to provide the best care because it's their family, their neighbors. And I love that model. And that's what we follow in all of our centers, Douglas, Sierra Vista. We try our best to employ locally. And so I think it's a wonderful thing just to see the staff today. It was wonderful.
Well, it's an amazing place, and so much what a labor of love that took to get this building where it is, and the labor of love that will continue for the greater Willcox area here at the Chiricahua Willcox Clinic. The ribbon has been cut, and it is time. How soon do you start seeing patients here?
Oh, this afternoon, I think.
All right, well, let's get them on. You know, let's get them in here and get them. Exactly, you got to kick us out of here for HIPAA violations or anything. But no, we're so glad to be here. Thank you so much for letting us be a part of this, Dr. Darlene, and of course, we wish you all the continued success. Happy New Year! Thank you so much. I know I'll see you again soon. But for everybody who has been a part of this adventure, everyone who is part of making sure this facility is here, we want to thank you for being a part of this. And thank you for watching this episode of Jeff Davenport Live, brought to you by SSVEC, Sulphur Springs Valley Electric Cooperative, serving our community, as is Chiricahua Community Health Center, right here at their brand new Willcox Clinic. It is open. Excuse me, guys. Sorry, coming through here. The brand new Willcox Clinic. The balloons are here, and you should be ready. If you live in the Willcox area, please do us a favor. Share this video around. Tag your friends and family who you know that live in the Willcox area. This is something for them that is going to be an amazing service. So thank you for watching. Thank you for sharing. Have a great day, everybody. We'll check in with you again later on.